you for having me on the show, Rishika. Yes, they have been quite dangerous, these strains, especially the one that you mentioned previously that was seen in South Africa and Brazil, rampaged through the UK. Also, the Kent strain that was seen here in the UK has now spread across almost 80 countries, including India. And the thing that we saw in the last few months was that there were a lot more cases that were being admitted to the hospitals. There were a lot more patients that were being admitted to the ICU in the hospitals, and then a lot more cases that were actually dying of COVID-19. And once that happened, I think the government had to take the steps that they have now and put the UK under lockdown, a very strict lockdown, and also impose travel restrictions. The United Kingdom is virtually cut off from the rest of the world at the moment. But, you know, things are improving. And I mean, I have some good news. There's less than 10,000 cases that have been reported now as compared to what we were reporting about a month ago, which was around 50,000 cases. The death tally has lessened by at least half.
Right.
We have now 700 deaths compared to 1,500. And I think the vaccination programs seem to be working. So the key here is to trace these virus strains, to know where the mutations are, to make sure that the isolation procedures are in place, the quarantine procedures are in place, and that the vaccination programs are working as they should be. 15 million people
I want to
have
just
been
interrupt
vaccinated.
you because you're talking about vaccines. Dr. Gupta, there are several questions at the moment on whether the existing vaccines will be able to counter these new strains, given the fact that many of these strains have a mutation that is known to surpass the antibodies that are present in the body. Just to explain this to our viewers, would you then say that the vaccine has been effective, especially against the UK strain, which is why you're seeing this improvement in the UK?
I think it's a two-factor approach that the government took. The lockdown has definitely helped, and the vaccine has helped. Now, so far in the UK, we've been given the Pfizer vaccine to most people. The AstraZaneca vaccine has started recently, but the Pfizer vaccine was shown to be effective against these variants and was shown to have a good antibody response even to the new variants. And I think, yes, that factor has to be taken into account when you look at the numbers. 15 million people have gotten the vaccine or the first dose of the vaccine in the United Kingdom, most of them the elderly, most of them the vulnerable population. And then there's also been a lockdown, which has been very strict, and there have been travel restrictions. I think there was a statistic saying travel has decreased by at least 50% in the United Kingdom in the last few months.
Yes.
So all of these factors together have made a difference.
Okay. You know, it's very interesting that you say that it's a combination of the vaccine and the lockdown. And currently, India's rate of vaccination is still lower compared to the global number, and we have no semblance of any lockdown anywhere in the country at the moment. Dr. Rakesh Mishra, are you then concerned with the emergence of these new rapidly spreading strains? And of course, there are questions still over the efficacy of the AstraZeneca vaccine to counter especially the South African strain. Are you concerned?
See, new variants are always a matter of concern, and these kind of viruses, that's the most nasty part. Additional thing is it's very fast spreading one. So that is why we have to practice all the means that we have, all the tools that we have. Today we have upper hand in India, at least, that infection rate is very low, and mortality is very low, and hospitals are in comfortable situation. But this can change any day, as you have seen in Europe, in many countries. We cannot simply afford one more lockdown, because that will lead to disasters worse than many other places, and will have very, very bad impact. So therefore, we have to use all available means. How to prevent the generation of variants is natural process of mutation, which viruses have, all organisms in fact have.
My question then, Dr. Mishra, is are we at a stage where we're considering that these vaccines may have to be tweaked in order to more effectively respond to the mutant strains?
It should be done, but those things take time. That means fresh trial will be required. One thing we can do is these vaccines are still effective. It has not been proven, except maybe Brazil case, which needs to be established. It requires more antibodies to neutralize it. But others are more fast spreading when vaccine is responding.
Right.
So we have to use the vaccine as much as we can, use the mask, which is our best bet at the moment, because vaccine will still take a month or two to kick in its effect. So we are, and if we can prevent the virus from spreading freely, we can similarly in the same proportion can stop the emergence of new variant. Variant will emerge if we continue to allow the virus to give more scope for larger number of people, spreading in more places for longer time. So that means virus has more options, and
Right.
sometimes some variant, even worse variant may come up.
Right.
So that is why
Dr. Gupta, if I can come to you then, the mRNA vaccines are said to be more adaptable, can be tweaked more easily. There's even talk of the vaccine, the mRNA vaccines already being tweaked or a booster shot being worked out. Do you think that's going to happen sooner rather than later?
Yes, and that's one of the advantages of the mRNA vaccine is the quick fix that you can do when variants emerge, rather than the antigen and live virus vaccines. So I think that's a great advantage, and yes, that will be used in the future to see what variants, and that's part of the reason that we are tracking these variants, to know what mutations are happening, so that if we need to, we can take those quick steps to change the vaccines and get it out to the people. But so far, there's been no indication that that is needed. Pfizer was very clear that the variants are being affected by the vaccine, and people are showing antibody responses. And so far, there's been 0 deaths and 0 readmissions from
Right.
COVID for the people that have been vaccinated. And
Yes.
that's an important thing to consider.
That's very important. Before we shift our focus, Dr. Mishra, I also want to ask you about, 2 very important stories as far as India is concerned. One being this cluster of over 100 cases being reported from an apartment in Bengaluru, and one being the rise in cases in Mumbai. And all of this is coinciding with the news of the new variants coming to India as well. Are you concerned? Do you believe we need to perhaps increase our genomic surveillance in order to better track the variants?
Genomic surveillance is absolutely essential, and that is how new variants were picked and steps were taken in UK, because they were doing very good job. We have not been doing that great job, but government is sensitive, and there are plans in place to do a large scale survey of, in fact, 5% of all the positives should be, and all the travelers should be screened if they are positive for the genome sequencing. But coming to your point, these 2 incidents of Bangalore
Yes.
or Mumbai, they may be coincidence. It's not proven yet that these are because of new variants. These are because of the simple lack of care that people should be taking. If they don't take the existing variant, existing variant is not less infective. It's just that new ones is a little bit more. And in India, all these variants which we have, new variant we are detecting is people with travel history.
Right.
So that means there is no lateral spread begun yet, which is a pleasant surprise, but that's what we have at the moment. So the spread in Bangalore and Mumbai may not be connected to new variant, or it may be yet another variant that we are yet to figure out.
So it definitely needs to be investigated. Both these sort of surges that one has seen, whether it's that apartment case or what's happening in Mumbai, need to be investigated to see if they're actually connected with the variants. Prima facie, of course, we don't know that yet. But I want to shift our focus, to the other big development that we've been tracking. India has administered the COVID-19 vaccine now, as per the latest data, to close to 90 lakh people in the last 32 days. Now, the government, however, has set a target of vaccinating 250 million people by July. That's 25 crore people that the government aims to vaccinate by July. Now, according to experts, India needs to drastically increase vaccinations because otherwise, at this rate, India is not going to meet the July target. As per the state-wise data that's been released by the Health Ministry, 8 states in India account for 57.8% of the vaccine doses. Uttar Pradesh alone accounts for 10%, over 10% of vaccines that have been given so far, followed by states like Maharashtra, Gujarat, Rajasthan and Madhya Pradesh. However, when you look at India's vaccination pace and where it stands globally, this is the worrying picture. As per data that's been gathered, by the 14th of February, India has vaccinated only 0.6% of its total population so far. What does this mean for our fight against the vaccine? Let's take this to our experts. Dr. Gupta, if I can begin by asking you, if you look at the UK and India, UK is over 23% and India still at 0.6%. Are we on track to meet that target? What does India need to do?
Yes, and this has been an issue in India. It has been an issue in the United Kingdom and many other countries. You see, the target is 60% of the population. You cannot effectively control the virus in community until 60 to 70% of your population has been vaccinated. I think the target that you set for 250 million in July is a bit unrealistic, to be honest, with the pace that is going on at this time, and with specific states being vaccinated more than others. I think that is concerning. But if you compare it to the United Kingdom, for instance, 15 million of the Pfizer and AstraZeneca doses have been given to the United Kingdom. But they approached it very differently than other countries. They decided, okay, we're not going to give the second dose immediately. We're going to delay the second dose and give it 3 months later so that we can vaccinate as many people as we can with the first dose, so that at least most people have some sort of immunity to the virus. And it was an experimental approach. A lot of debate has been done over it in the scientific community around the world, whether it is the right approach or not. But so far, I think it seems to be working. And you'll see those numbers go down a little bit. So you won't see it increasing as fast as it has as the second doses of the vaccine start to be given in the United Kingdom. And I think other countries will then catch up to the UK in that respect. But yes, the pace needs to increase, and that would involve training more people to give the vaccine, setting up more centers, and actually getting it out to the rural communities where the virus may be spreading.
Well, the fact that we need to step on the effort to vaccinate more and more people, and we need to do it quickly, I think has been highlighted by all experts. But Dr. Srivastav, Chief of Neuroscience at AIIMS, also joins us. Practically, Dr. Srivastav, what can we do to expedite the pace of vaccination, because 0.6% is not taking us to our 25 crore target in July?
Yes, exactly. So I totally agree that this is really not going much anywhere. Said that though, so I've heard that, when they actually looked at what were the limiting factors, one was some problems, some hitches in the app, the COVID app was there. So the data which was fed and the data which was coming out, reaching out to people, calling out to people even for the second dose, there was some issues. So they're going to look into that. I think that needs to be looked into. The other is even in the healthcare facilities. It's now become mandatory that, you're being given deadlines. Like it was said that, okay, 25th February is your deadline. Please get vaccinated. After that, it is not going to be free. So I don't know. I feel it is unfortunate that we need to resort to do these things because it is voluntary and we need to come forward. And I think why people are not coming forward so very, voluntarily, so very effusively, I suppose is one, this concept that there is going to be a herd immunity. We already have that. Number two is that a lot of us do have infections, and then we've got infected. Do we really need to be vaccinated? And that's being addressed to repeatedly, but that still probably has not percolated down. And number three is, the concerns about the vaccine itself. And actually, when you look at it, the ratio of problems with vaccine is really very, very small. But then that one case is getting highlighted, and that's probably all the reason why people are going, backwards.
Well,
so all these things, again, it will be awareness and awareness.
Yes, well, multiple reasons. And Dr. Gupta, any advice? What's it like, in the UK, for instance, there is a phase-wise dissemination of the vaccine there as well. But mass vaccination, opening it up to the private market, freely available, is that the way forward?
Well, I think it may have to be for India, but I think also one of the most important points would be spreading awareness. There has to be a concerted campaign from the government to actually spread the awareness. For instance, in the UK, we have radio messages, TV adverts in the middle of programming, and billboards everywhere, that are encouraging people to go and get their vaccine, which saves lives. And I think that effective campaign needs to reach out to the people. Otherwise, people can get complacent, which is probably already happening in India. And once these variants start to come in, then those people will not be protected just because they've had the infection before. So I think that it's a campaign issue. It's a more of a awareness issue. But yes, of course, it can be helped if the private partners come in.
All right. So
a combination.